There's a genetic component to the discomfort related to flat feet. If you have bad feet, the odds are very good that your parents had bad feet, and the odds are strong that your children will have bad feet. Notice when we hold this foot in a more neutral position, you can imagine that this knee would function far more optimally with ground forces in this position. In this position, it's very easy to imagine troubles occurring with the ankle, the knee, and the hip. Studies have shown that obesity rates are far greater in children that have a foot shaped like this from behind. Check your children from behind. If you have a 10-year-old that wants to be on the couch all the time watching TV, the odds are very good that it isn't because they're lazy, it's because they're in pain when they're active. Further, if you have a 4-year-old that still wants to be held all of the time, the odds are very good that it's not because they're needy, it's because they're actually in pain when they're standing and running. Up until the age of 4, it's quite normal for the foot to be in a flat position. In fact, the structure of the foot doesn't really come into its own until the age of 4. The bones take that long to form. But between the age of 4 and 7, that arch should start to form to approximately 1 to 2 degrees each year until the age of 7. If by the age of 7 that arch has not formed, it's not going to. Flat feet do not fix themselves after the age of 7 or 8, and they never turn out good. We need to interact with this foot as soon as possible so that the foot, the ankle, the knee, the hip can be in an optimal position with regards to how they interact with ground forces before this child starts to put on weight. Many clinics charge $75 to $100 for an initial assessment. At Ortho-Care, we don't do that. We'd be very pleased to have a look at your child. Come on in.